Hi, my name is Nathan and I've been an exercise physiologist for now on 20 years. So I first started being an exercise physiologist because I like sport and I like science. And after studying, I started a thesis in heart failure rehabilitation, and I travelled not long after that for 6 months because I still didn't really know what I wanted to do. And then I started working at the Austin Hospital, and that's when I first fell in love with helping people with chronic fatigue syndrome. So I was blessed to work with adolescents in an inpatient setting, and it really showed me the changes that I could make with these people, and I ended up doing that for 3 years. I initially only was going to be there for 1 year because I wanted to travel, but it took a bit longer. However, that travel bug took me to the UK after a lot of travel in between, and I started working at an adult inpatient or adult outpatient clinic for people with chronic fatigue syndrome and ME. And this was really a turning point, as it taught me so much more about the tools that we can use to this day and we've continued to develop. And I worked there for nearly 3 years and had to make the choice: do I start to live in the UK for 5 or 6 years, or do I bring back my knowledge to Australia and really start to try and change the landscape of fatigue as we knew it then? So on my return, I started working at the Austin Hospital and actually took over the adolescent inpatient program and developed that until it moved to the Royal Children's Hospital. And I also started Active Health Clinic because I knew there had to be a better way of doing this, and making sure people were really respected and got the care that they needed. But along this journey, I actually developed sarcoidosis, which is an autoimmune condition. And one day I woke up with a bit of trouble breathing and my feet had started to swell. And when I was getting out of bed, it really hurt to walk on my feet. It felt like someone was putting a needle into my foot, but at every single point it just hurt everywhere. And over the next day, it started to progress to feeling feverish and muscle aches and pains and just generally feeling really terrible. And so I went to my doctor and said, I don't think this is right. And they said, sure as hell isn't right. And I went to a doctor, then another rheumatologist, and I was diagnosed with sarcoidosis. So I was fortunate enough for that process only to take 2 weeks. However, being in that or having that feeling really gave me a lot of empathy and understanding to actually how people feel every day, because there's not a break with fatigue, there's not a break with the pain. And I was put on to high-dose prednisone, so a steroid, for 18 months because I tried to come off that at multiple times. However, my symptoms came back. And it was only through a lot of the work that I'd done myself and pacing myself and ensure good quality rest and really making sure that I could minimize the stress as much as possible, that actually led to me being able to take control of my health. And I think really at that point it's cemented again why I do the work that I do, and we really began to expand our clinic at Active Health and the people that we have our team, so that we can actually make these invisible illnesses more visible and impact more people.